Good day everyone, I am Monica de Guzman from BSN 111C, and so for today's video I'll be doing an parenteral administration, which are the intradermal injection, subcutaneous injection, and the intramuscular injection. Okay, so without any further ado, let's get started. Now, I'm going to perform a administration of the medications through intradermal injection. So, prior for the performing to this assessment, first we have to check the doctor's order. And we have to perform the procedure, introduce yourself, and verify the client's identity prior to the agency protocol. And of course, we have to explain the procedure to be done on how the client participate on this assessment or in this procedure. Okay, sir, I am Monica de Guzman, your student nurse for today. And for verification, may I ask what is your name?
Leonard Batecan,
Your age?
20 years old,
How about your birthday?
February 2002.
Okay, so for today, sir, I'm going to give you your medication, which is being prescribed by your doctor. It is a penicillin for your allergy, and we're going to see if you have any allergy, and of course that you just have to relax. You may get a side effect of dizziness and headache. Would that be okay? All right. So I already arranged the medication card on the hypodermic tray, which is the corresponding drug. So next we have to choose the injection site to see if there's any lesions or discoloration. Select the 3 to 4 finger widths below to the anti-cubical space and one above the wrist. Now we have to position the client on client's arm on the flat surface, or for that the elbow and the forearm are on the flat surface. Alright, I have already apply a clean gloves, and of course I'm going to use antiseptic swab to clean the site of the beginning of the center in circular motions outward about 2 inches or 5 centimeters. Now we have to remove the cap and hold the syringe, and between the thumb and the forefinger at your non-dominant hand. Stretch the skin tent at the injection site by pulling gently with the thumb and forefinger at your non-dominant hand. Pull the needle very close to the patient's skin. Insert it slowly at 5. Encircle the wheel. Encircle the wheel with blue or black pen and instruct patient not to rub the wheel or erase the mark. Okay, sir? You should not rub the wheel and erase the mark. Will that be okay?
Okay.
Alright. Okay, now we have to position the client into a comfortable position, and that we have to indicate the time for reading. Don't use the needle. Don't use a recap needle, discard needle, and a syringe to appropriate receptacle. So, wash hand and document the procedure. Okay, sir. I'll be back for 30 minutes to see the reaction of the medication. Would that be okay? Do you have any questions? Alright, that's great. Alright, so today I'm going to give a medication through a subcutaneous injection. So we have to check the doctor's order first and the patient's chart. And prior to the performing of the procedure, introduce yourself and verify the client's identity using the agency protocol. And explain the procedure to the client on how she and he can participate the procedure or this assessment. So we have to discuss the client, the purpose of each medication, and its actions and the possible side effect. So, sir, I am Monica de Guzman, your student nurse for today, and for verification, may I ask what is your name?
Leonard Batecan.
Alright, how about your birthday?
February 2000.
Your age?
20.
Alright. So, sir, your medication is prescribed by your doctor, which is Dr. X. It is a penicillin for your allergy, and that you may get a dizziness and headache in this medication. So, prior for this, you have just to relax and not too worried. Alright? Okay. So, we have to determine the site that I'll be using and shift the patient's bed linen to expose the potential injection site. Inspect area for bruising, inflammation, and edema. Alright, we have to palpate the site to avoid area that is tender. To make sure that you have the right side of the needle, use your thumb and forefinger to grasp a skin fold of tissue that in the injection site. Alright. Okay, sir. Can you please relax the injection site that I'll be going to inject your medication. So we have to apply a clean gloves. Okay, now we have to apply clean gloves. Clean the site with antiseptic swab in a circular motion. Alright. Now we have to remove the needle cap by pulling it straight off. Hold the syringe and we have to remove the cap. Insert needle quickly and firmly at 45 to 90 degree angle. Release the pinched skin. Rest your non-dominant hand on the patient. Alright, now we have to inject the medication over several seconds using the syringe. It's a high range. Quickly withdraw the needle, place a swab on the gauge pad on the site and don't massage it. Okay, sir, don't massage the area that I have just injected. Alright, now we have to place the patient into a comfortable position and we have to document the amount of the medications given and to the medication sheet. Alright, sir, now I will just be back to see the reaction of the medications that I have just given to you right now. And do you have any questions, clarifications? Alright, thank you so much, sir. And today I'm going to give a medications using the intramuscular injection. And of course, we have to check first the doctor's order on the patient's chart. Okay, prior to performing this procedure, we have to introduce ourselves and verify the client's identity using the agency protocol. Explain the procedure to the client and how she can participate during this procedure. Okay, sir. So, I am Monica de Guzman, your student nurse for today. So, for verification, can you state your name, sir?
Leonard Bataypan,
Your age?
20 years old.
How about your birthday?
February 2000.
Alright, that's great. So now we have to perform a hand hygiene to avoid getting any pathogenic microorganism and to avoid cross-contamination with the patient. So now I'm going to select an appropriate site for injection. Now we have to examine the integrity and the amount of the patient's muscles and palpate the muscle area for tenderness are not suitable for injection site. Alright, now we have to inspect the area for bruising, inflammation, and edema. Help the patient into a comfortable position. We have only to expose the area that has been that will be injected. Okay, there is no inflammations and edema. So now we have to apply the clean gloves and use anatomical landmarks to find the site again. Now we have to disinfect the injection site in a circular pattern from inner to outer for about 2 inches. Now we have to hold gauge pad between the third and fourth fingers of your non-dominant hand. Hold the gauge pad between the third and fourth fingers of your non-dominant hand. Now we have to remove the cup, and we have to remove the cup by pulling it straight up. Place your ulnar side of your non-dominant hand just below of the injection site and pull the patient's skin laterally about 1 to 1.5 inches. So we have to hold the position until we inserted the needle. Tilagyo ay.
Nangurog yung kamot.
Now we have to place your ulnar side of your non-dominant hand just below of the injection site and pull the patient's skin laterally about 1 to 1.5 inches, and we have to hold the position until the needle are being inserted. And then we have to inject the medication. Slowly withdraw the needle and place a dry cotton ball on the site that has been injected.